So good afternoon. It's great to be here with you all today for our webinar focused on what to expect during move-in and quiet period. I hope that we find you safe and well and looking forward to your return to the Providence area. We look forward to seeing you very soon if you haven't already arrived off campus, certainly for move-in this weekend. I am fortunate to be joined by 6 of my colleagues today who will provide you in short presentations some information up front that I think you will find informative and valuable. I will introduce them in a second and they will present and then we have questions that you have submitted in advance when you registered. We look forward to answering as many of those as we can. Along with questions if you use the Q&A function that you can ask during the program, and we will try to get to as many of those as possible as well. Today's program is going to be recorded and then it's going to be posted later on the Healthy Brown website so that those who could not join us today can certainly watch a little bit later. So let me introduce my colleagues. We're fortunate to have Rick Rudnick, who's the Associate Dean and Director of Residential Education here, and I'm going to introduce them in the order that they're going to present. He's going to talk about move-in. We have Dr. Vanessa Brito, who's an Associate Vice President for Health and Wellness. She's going to talk about pre-arrival guidance, quiet period from a public health perspective, and testing. We also have George Barboza, who's Director of Dining Programs. He's going to talk about meals during the quiet period. Joey Steele, who's Associate Dean and Director of Student Activities, is going to talk about programming that will happen during the quiet period. We have Rashid Zia, Dean of the College and Professor of Engineering and Physics. He will talk about virtual shopping, course materials, and other things academic. And we also have Michael Guglielmo, who is Vice President for Facilities Management. He's going to talk about cleaning and maintenance of residence halls as well. And so thank you. And they will be joined during the Q&A by our colleague, Corin Bakagard, who is Associate Vice President for Campus Life and Dean of Students for the Q&A. So with that, I'm going to hand it off to Dean Rudnick to get us started and look forward to our conversation today as we have an opportunity to learn more about move-in and quiet period together. So Dean Rudnick.
Thank you very much. I appreciate that. Wanted to talk a little bit today about move-in so that folks can have as much timely and accurate information as possible. So what I want to lead with is students will receive their housing assignments via email by the end of the day this Thursday. Included in this message will be the students assigned move-in time and check-in location. We're having folks arrive at different locations so that we can continue to distance and make sure that social distance practices are present in everything that we do. Be sure to complete the educational module and student commitment in advance of your arrival. This is really important that that is done before you show up on campus. Daily reminders are being sent to students who are confirmed for phase 1 arrival on campus, and off-campus students who have indicated will be in Providence before September 11th. What to expect when you arrive on campus at your specific point of check-in. Students should arrive at their designated check-in location at their scheduled date and time and display the email with this information. So you'll want to have something on you that verifies that information so that eases the process of moving you forward and getting you access to your space. Students can have 2 people accompany them to assist them with that move-in, not more. That's really important because we want to keep this as safe as possible and limit the amount of folks that we have in contact with each other. Movers will be on site to help unload vehicles, and we will have carts that will be available for students to borrow. We want to make this process of move-in as simple and timely as possible, and we want to provide as much assistance as we can for that. Students will receive a personal protection equipment packet that will have masks and hand sanitizers and cleaning products when they pick up their key. It's going to be really important that when you're on campus, you have access to these things and that you're always wearing your mask and you're always taking steps to make sure that your environment is clean and you're not at risk, right? And anyone assisting students moving into the residence hall will be limited to assisting them with getting items into the room. They should not linger in the residence hall or campus. We know that there might be some desire to spend quality time and enjoy that moment, but we really need to have the move-in process be as efficient as possible and people exit the residence as quickly, because we're still in this environment of making sure that folks are as safe as we can make them. RPLs will help students learn guidelines and be supportive during the quiet period. We know that the quiet period is going to have different types of engagement across campus that you'll learn about more today. But we also know that our RPLs are going to be important role models and actively work to set examples of how to be in the COVID environment on campus. In addition to your personal protection equipment that you'll receive, there's also going to be a private quiet period kit that will be issued to you. This will have primary prevention materials that will further help you prepare for being on campus. It will include activities and discussions relevant to pods. It will talk about risk thresholds so that you can have conversations with your peers. It'll give you opportunities to talk about your needs and wants while living in the residence halls during quiet period and moving forward. And it will help you to establish expectations for your peers so that your pods can be more successful. Now, it's important that after move-in and throughout the term, the only guests that are allowed in the residence halls are students who live in on-campus residence halls, right? So you would not be able to have folks from off-campus come and visit you in your residence. And we're doing that because we're trying to maintain these COVID environments so that our students are safe and that we are controlling who is in our facilities. We really appreciate all of your support and consideration in following these policies and practices. And if you have any questions, the folks in Residence Life are here to help. Just let us know, let your RPL know, and we'll do what we can to get you accurate information as soon as possible. Thank you so much, and I'm going to hand it off.
Thanks, Rick. Welcome, everyone. We're excited to have you join us very soon. I'm going to talk with you for just a moment about a couple of things that we want you to understand prior to joining us here at Brown. First is pre-arrival. That's happening right now, wherever you are. We would hope that while you're preparing to travel to Brown, that you begin to think about having your own version of a quiet period, or just kind of a slowing down and maybe beginning to, minimize many of your own social contacts as you prepare to travel. Excuse me. We know that there have been many campuses where testing has been required prior to people traveling to campus, and we will not require students to have tests prior to arrival. Certainly if you have a personal risk that puts you in an elevated category, we certainly want you to be able to do that. Or if you, for example, have been in a high-risk occupation over the course of the summer, having access to testing may be available to you. And so we certainly don't discourage you to do that, but it's not a requirement at all. And if you are positive, this would be an opportunity for you to be able to isolate at home prior to traveling. When you do begin your travel, we would advise you to, again, wear face masks or facial coverings, and practice social distancing, use hand sanitizer as you're traveling to Brown. When you arrive, we will have you, as Rick said, move in over the course of several days and begin to observe a quiet period. We want everyone, once everyone is here and in their rooms, to begin to observe the quiet period together, such that we understand the community as a whole. We want people to start the clock at the same time, to have access to the same tests, and be able to really understand the positivity rate and prevalence within our community. Excuse me. So it's during that quiet period that we will talk with you and have you get to understand what the new normal is. We'll have you understand in more detail some of the public health guidelines that we'll all be following in the community. We also will begin to initiate testing during the quiet period. So as close to the first day as possible, we will have all students have tests done twice a week. The tests are self-administered, pretty non-invasive, and if for whatever reason students aren't comfortable with administering the test themselves, there will be clinical professionals on hand to help with that. Why are we testing? It's very important. This is a tenet to understanding this coronavirus everywhere. And so we feel that it's very important for us to have our asymptomatic students who aren't experiencing any symptoms, engage in testing. And certainly if people are having symptoms, we have a special provision outlined for students to be able to access health services, be evaluated and tested if necessary, and have that test result come back in an expedited way. We also want to make sure that we understand who is positive. We want to do that quickly so that we can have those who are positive or those who are exposed to people who are confirmed to be positive be transitioned to special reserved housing that will allow us to wrap services around you and allow you to be able to monitor yourself and for clinicians to be able to monitor you as well, and have that be separate from the general community. Quarantining and isolation is not anything new, although we've been talking about it a great deal over the last few months. It's certainly a public health pillar and something that we use in terms of a tool often in the setting of infectious diseases. So we certainly want people who have been testing positive to be isolated for 10 days. And for those who have been in contact to be quarantined while we monitor those folks for a total of 14 days, during which time there is a possibility for the virus to incubate and present itself. So you can't test out of quarantine, in that we really do need that period of time to understand how the process is evolving in any one individual. We also think that it's important for us to find ways for students to have the things that they need. So we want you to bring the things you need with you, travel lightly, but not have students having to go to get their mail and having to go to the bookstore and all of the other places. We're really asking students to use this as an opportunity to really understand how it is we're going to be together as a community in the healthiest and safest way possible. So those services will be closed. We'll work on a process to manage things that are essential, but we certainly don't want students to feel obligated to travel out into the community during this quiet period. We, as Rick said, everyone will have a supply of face coverings. There will be plenty for everyone, and certainly as time goes on, if people need additional supplies, we'll have those on hand. They are such that they can be washed with your regular laundry. There's nothing special about how you need to launder them from the standpoint of separating it from your regular laundry. They can be laundered with everything else and then reused. So I will stop there, and I will pass on my comments to my colleague, George.
Thank you, Dr. Brito. It's a pleasure to be here today to talk about what meal service will look like during quiet period on Brown's campus. First, I should let everyone know that Brown is committed to providing meals to all on-campus students, whether they opted into a meal plan or not during the quiet period. So every student who's assigned to a rooming assignment on campus will be provided meals. What it will look like is we have identified 2 locations on campus, the grad center and the perimeter on the outside of the Verney Woolley Dining Hall. And based on your rooming assignment, you will go to these locations daily to pick up a grab-and-go meal. The hours will be 12 p.m. to 2 p.m. for lunch, 5 p.m. to 7 p.m. For dinner. And when you pick up your dinner, grab-and-go meal, it will include your breakfast for the next day. And all of you have refrigerators in your, if the breakfast needs to be refrigerated, you will have a space in your dorm in the refrigerator to put your breakfast meal. Kosher meals will be available for those who have opted into the kosher meal, and there will be a vegan option at every meal period as well. For those who may have food allergies, we don't want to do anything different than we would do during the normal course of the year. And so I would encourage anyone who has food allergies to reach out to our Assistant Director of Health and Wellness for Dining, Jessie Curran, that's JESSIE_Curran, CURRAN @brown.edu. Jessie and the team of culinarians are waiting for these requests to come in, and they will work with you one-on-one to build health and safe meals for you. As we transition to the quiet period, then other dining halls will begin to open, and we will provide, based on whatever meal plan you opted in, then you will transition into your normal meal plan. But for a quiet period, that is essentially what meal period will look like on campus. And I will transition to my colleague Joey Steele from SAO.
Thanks, George. I just want to briefly talk about programming that we're offering through the quiet period. I want to start with a thank you. We received over 200 submissions for that 2-week period, and I want to give a particular thank you to our student organizations that really rose to the challenge. The summer is not the easiest time to group up and put something together, and they really have submitted a significant number of events, and I think students will really enjoy those things. We have a really robust calendar of events. We're looking at this in 2 ways. One, as a way to provide opportunity for remote engagement for students on campus through quiet period, but also as a virtual kickoff for all students to the semester, regardless of location of study. I think there really will be something for everyone, and so we really want all students to feel like this programming is for them and it's accessible to them. Ways to find the events that are happening. So they are all, as of today, live in the Brown U app. If you already have the app downloaded, you just need to go in and click on the little person icon and change your persona to quiet period, and you'll see everything listed. If you're newly downloading the app, and quick plug for the Brown app, it's awesome, so download it if you haven't yet. Those events will come up for you right away, and so you'll be able to see everything. You'll see that there's categories, so you can look for academic resources, you can look for community building if you have a particular interest that you're looking for over those 2 weeks. If apps are not your thing, no judgment. The events will also be on the Student Activities website in a Google Doc, really easy to find and navigate. And so there's multiple ways to get to the information. If there are any questions about anything, or if someone who submitted an event now wants to make a change to their event, feel free to just email either SAO@Brown or me directly at Joey_Steele@Brown, and I can make all of those changes. But again, huge thank you to the Brown community for coming together and putting together a really great 2 weeks of remote engagement. And I think I am passing to Rashid.
Thank you, Joey. Hi, everyone. My name is Rashid Zia. It's my pleasure to serve as Dean of the College. And I just wanted to talk a little bit about what academic engagement was going to look like during the quiet period. First off, I know that everyone's curious about how shopping is going to work because it's a tradition of the Brown experience to be able to explore new classes. And so this semester, what we are going to be doing is setting up a virtual shopping experience. So in past years, what has happened is during the semester, during the first 2 weeks, if you added a course to your CAB primary cart, then it also meant that you are automatically given access to the course materials that might exist on Canvas. This year, we've moved that up. So as of last week, if you put a course in your CAB primary cart, within 2 to 5 minutes, if that course has a published Canvas site, you should see it at canvas.brown.edu. And for the vast majority of classes, they're using Canvas as the way to share course information, and they're using the Zoom integration in Canvas to set up class times and meetings. So if you want to know how and where to participate, please go to canvas.brown.edu to see the course materials. Now we're still a couple weeks away from the start of the semester. Classes don't begin until September 9th, and traditionally syllabi wouldn't have been posted for classes until September 2nd. Right now, many of your instructors are working to get up at least provisional syllabi and set up published Canvas sites earlier than that. And you should see the numbers of those increase over the coming days. There will also be, if for those students who are first years and second years, we are reaching out to advisors now to help set up the first set of advising meetings. All advising meetings this semester are going to be taking place virtually. So first year students should expect outreach from their Michael Johns and academic advisors soon, likely this week, to set up their first meetings. And then sophomore advisees should hear from their faculty soon. We are hopeful that being able to set up individual meetings with each other via Zoom will actually help to build connections between you and your academic advisors. Finally, we know that many students have questions about how to get access to course materials, books, and other required course materials. So please know that the bookstore has been working in partnership with the university library to help digitize materials, especially those materials that might be used at the beginning of classes. So when you go into Canvas, that you will see that a fair number of materials are available to you digitally through Canvas. The bookstore has also set up a dedicated set of processes to allow you to order your books online. You can do that through Banner, or you can do that through the bookstore website. For those students who are living off campus or studying remotely, you will have access to digital materials. The bookstore is also working and has started shipping out materials to you. We understand that there have been a fair number of questions about the students who are moving in early on campus and how they are going to access the books. So the bookstore is right now partnering with other university offices to find out how to get physical materials to students during the quiet period. But please know that students will have access to digital materials instantly, and there will also be digitized materials on Canvas to help you start off the semester. So with that, I think it covers the main issues that we wanted to speak about for advising. Oh, one more thing. For sophomore students, there is no alt PIN this semester. So for those of you who are waiting for access to a PIN to register, all sophomores, juniors, seniors can currently add and drop courses for the semester without any restrictions. So with that, I want to pass it over to Vice President for Facilities Management, Michael Guglielmo.
Thank you, Dean Zia. Once again, Michael Guglielmo. I am the Vice President of Facilities Management, and today I'll touch on a couple of items that we have been working on in preparation for your returns as it relates to the quiet period and the residence hall. These areas cover all of the pre-arrival cleaning, some augmentations to the actual cleaning schedule within the dormitories, a development of a DIY program, and also how you would go about, again, submitting work orders, service response, requests, and finally, kind of the importance of disposing of food and trash properly with the grab-and-go system that has been developed. In regards to enhanced cleaning and disinfecting, we have worked closely with all the guidance sent out from CDC and also with environmental health and safety. We have developed a schedule of increased routine cleaning and disinfecting within the respective dorms and other buildings on campus. We are using all products that meet EPA for disinfecting criteria. We are also encouraging all the students with the PPE packs to really take a leadership and ownership in their personal items, i.e. your cell phones and other electronics and anything within your respective living areas. One of the things that you will see in regards to the disinfecting of all high-touch areas on campus and within the dormitories, these services will now be 7 days per week. In the past, they were Monday through Friday and then some selective work on the weekends, but now you will have presence in the dormitories, again, 7 days per week, and really focusing in on those high-touch areas and the restroom facilities. Switching to the DIY program, this real individual responsibility will make a major impact on all of the enhanced cleaning we'll be doing. And as has mentioned a couple of times within the discussion today, all staff, faculty, and students returning to campus will be provided with face coverings, and they'll also include a hand sanitizer, 2 within your initial startup pack, and a container of wipes to be utilized while you're within your individual spaces. Some of the QA, QC tools that we have deployed as part of this enhanced cleaning, our custodial staff, supervisors, and managers will be doing a Smart Inspect daily disinfecting and cleaning log. This documentation will comply with the Rhode Island Department of Health. We have purchased multiple Protectis handheld electronic sprayers. This will be used within the respective dorm rooms in preparation for your arrival. And then the final step in preparation for your arrival is an ATP validation test. This meter allows for rapid testing to assess the cleanliness of all the surfaces within your respective dorm rooms. Switching gears a little bit here to some of the building prep. I'm sure many of you have heard that we have spent a good amount of time looking at the heating, ventilation, and water systems in the buildings. This is all in compliance with CDC and some standard best practices. All water systems have been flushed in preparation for your arrival. And then, as I think you can see or might have seen in the back of Dean Zia's background there, we have deployed a series of different signage packets on campus, ranging everything from the guidance regarding wearing your face mask while on campus, maintaining a safe distance, and then a series of wayfinding and occupancy signage on campus. Wayfinding for stairs up, down, and occupancy such as how many individuals allowed in a restroom, and then also within elevators. Couple of last points here. If you do see any issues within your room, either upon your arrival or while you are occupying during this quiet period, you can always submit a work order or service request 24/7, 365 days a year. There are 2 methods, one being online through the FM website, service request, or you can always call 863-7800, and there is staff manning the staffing those phone lines to take any work order request. And then finally, you heard a lot about the grab and go during this period. As you can imagine, that's going to have quite an intense uptick in the amount of trash that is generated within the dormitories. We have increased the frequency of that removal, but it's really, really important, and I want to stress this, that you are taking that trash to the respective trash rooms within your residence halls. This will reduce the risk of any insects, bugs, or the proverbial rodents by getting that trash into those respective areas, and then we can get it out of the dormitories on a daily basis. At this point, I'll turn it back to Eric for any questions.
Thank you, everybody. I really appreciate each of your informative presentations. We have received a number of questions in advance as people registered for the webinar, and even more questions now during the webinar. So I look forward to helping get as many of those questions answered as possible. It may be that I'll group some of the questions together and try and do justice to the questions that are being asked, because there are themes that evolve and emerge around testing, for example, or around meal offerings and things like that. So I'll do my best to ask individual questions, but also try and group some questions that are very, very similar. Director Barboza, there was a question that came in when you mentioned sort of like kosher meals and vegan meals. and the ability to contact your colleague Jesse Curran around food allergies. Will there also be halal options available as well?
So what we have done for the entire fall semester, not just quiet period, is every meat entree that is prepared, we have sourced it through a halal vendor. So if it's beef, pork, I'm sorry, not pork, if it's beef, chicken, lamb that's on the menu, whether or not we're identifying it as halal, all meat for the fall semester has been sourced through a halal vendor.
Great, thank you. There have been a number of questions around testing, and I know that students got an email yesterday around student testing, and they're getting, you all are getting a reminder today. I was wondering, Dr. Brito, if you could talk just a little bit more about testing on campus, off campus students. My understanding is that all undergraduates will be required to be tested twice a week.
Yes. So all students who are planning to enroll in, we're all hopeful, in-person classes eventually, whether they're on campus or off campus, will be invited to enroll, or required, not invited, required to enroll in our testing program. That program will happen, as I mentioned, beginning as close to September 1st as we can get it launched. And we want it to start at the same time for everyone. So coming early doesn't mean that you will get enrolled in the testing program early. So we have a location on campus where we can accommodate a large volume of students, socially distanced and appropriately supervised for that. And there will also be another location a little further away from campus in the jewelry district for medical students. But specifically, we want all of our students to participate in the program.
Thank you, Dr. Brito. I'm the OMAC to get my test at 2:15, so I'll report back as to how it goes.
Great.
Dean Bakkegaard, I was wondering if you could talk a little bit about, we've gotten some questions about the commitment that students are being asked to sign, and then the module that being required of on-campus students, off-campus students, all students. So maybe if you wouldn't mind sharing just a little bit about those two things.
Sure. One of the things that we've done, and I think this happened on Friday of last week, any of the students who have been approved to move on campus for phase 1, so those are the students who are arriving this weekend, those students should have received a personalized link to the student module and to the student commitment. If students have not yet completed the module and the commitment, they should be receiving daily reminders for anyone who hasn't completed that yet. We'd also asked any of our students with off-campus permission to register with us what their arrival date in Providence was going to be. We had set that deadline for just a little bit before midnight Thursday night. So on Friday, we were able to identify any of the off-campus students who would let us know when they would be arriving in Providence. And those students also received the personalized link to complete the module and the student commitment. I think there have been some students who have provided their arrival date since that after the deadline. So we're reaching out to those students as we become aware that there are some students who are letting us know when they're coming back to Providence. But if they didn't get it in by the deadline, it's just a little bit delayed when we're sending the module out. So if anyone is looking for their link and trying to find the link for the module and the student commitment, just wait and you'll get your daily reminder again. You can also search maybe in your bulk mail folder, maybe it went to your junk mail, but the daily reminders should be coming out so that every student who's returning to the Providence area, whether they're going to be on campus or off campus, should get the information they need with the module and the commitment.
Great, thank you so much. We're also getting some questions, Dr. Brito, about what kind of support medical care off-campus students will have. And then also some questions about what the quiet period means for off-campus students. And I'm wondering if you could talk about both.
Sure, absolutely. So it's very important for us as a community, whether people are on or off campus, to observe the quiet period at the same time. The two populations of people, if you think about it from a public health standpoint, will potentially be coming together. Again, hopeful that we'll be in person and be able to socialize in person. And so for now, as we are understanding those two populations, we really do need people to not come together, but we want everyone to observe the quiet period at the same time, and again, go through the testing program at the same time. There was a second part to your question, Eric.
Sure. If off-campus students have the need for medical support,
Right.
what will look like?
Exactly. And so, and yes, every student who is enrolled in the program that is here in Providence will have, or in the area who hope to be in person, has access to health service, whether it's via telehealth, or again, if symptomatic, they can certainly access the health service in the respiratory clinic. Same is true for CAPS. Telehealth services are available for students to access CAPS as well. So yes, on or off campus services are available to students.
Great, thank you. Dean Rudnick, I was wondering if you could talk a little bit more about the microfridges and their availability to students. We've gotten a few questions. I will readily admit at the beginning of this summer, I thought a microfridge was just a really tiny fridge, but apparently it's a microwave and a fridge. And so I was wondering if you could share a little bit about that.
Oh, absolutely. Every single one of our rooms has had a micro fridge placed in it. And what it really is a convenient way to keep items cold and cook and prepare different items. You know, there's a lot of different things that you can do in a residential setting to, you know, get creative with food when you have access to a microwave and refrigeration like that in your space. But it also means that, you know, in those moments when you want snacks or you want to, you know, store food for later, you have the convenience to do that. They're small and space efficient for a room, and they're quite robust in what you can do with them throughout your time having them living in the residence halls.
Great, thank you very much. Dean Bakkegaard, we've gotten a couple of questions from people who are worried about travel in relationship to move-in assignment. And so someone who might be coming in later than they expected on a flight in the evening, after hours. What's our recommendation for how we can help them figure out how to navigate move-in?
Yes, we're working on a communication that will be sent to students coming on campus on Thursday, and that will contain your housing assignment, your check-in time, your check-in location, and some more specific instructions about what to expect when you are arriving. One of the things we're also going to note in that communication, if there are any students who are experiencing symptoms of COVID-19 on the date and the time when they're expected to arrive, how they should contact Residential Life to make different arrangements. And we'll make that note in that communication as well. If students anticipate having a significant travel-related conflict with their specific move-in time, we'll provide information there for how they can connect to what alternate arrangements might be available.
Great, thank you. Dr. Brito, we've received some questions about you know, the stages of quiet period and the ability to move and outside the residence hall. We know that that's going to be significantly limited to very specific things. I'm wondering if you could talk just a little bit more about that. And then also a question about after the quiet period and how we imagine the opportunity for students on and off campus to be able to interact with each other, since we know they won't be doing that during the quiet period necessarily.
Right, so during the quiet period, we do want students to move minimally. We are really asking for students to understand that this is not normal. These are not normal times, not normal circumstances. We understand that we're all social beings, and this feels very counterintuitive. But for this moment, what we need is for people to really observe the quiet period, for the most part, in their rooms. As we talked about, there will be meal distribution. We certainly know that people will be sharing communal bathrooms, but they'll have their own personal space will be single space. The first week of quiet period is especially important. We're planning to get at least 2 tests in during that week. And so until we have that information back and understand truly that someone is not incubating and we're a little closer to knowing the fullest answer to that question, we really do need people to be minimizing their movement. Once we get to the second week, we do expect that people will be able to maybe get outside to, in close proximity to the residence hall, socially distancing, if they're, wanting to get out to get some exercise and that kind of thing. And also we'll be able to have people, again, go to get their meals, grab and go a little further away from the residence halls. We also do expect that, over time, we do think that it's important for people to minimize their travel and minimize their movement, even in the broader community, for all of the reasons that we're observing a quiet period, even, just to minimize the number of social contacts and be able to apply physical distancing to our lives. It's our new normal.
Thank you. And just to clarify, during the quiet period, for on-campus students, my understanding is that even the limited movement that would be allowed, particularly in the second week, would all have to be on campus. There would be no off-campus movement.
Yes.
And for off-campus students, their expectation would be that they would not come onto campus during those 2 weeks. Is that correct?
That's right. For the reasons that we talked about earlier, in terms of not having the two populations sort of come together before the quiet period is over. So yes, we do want people to observe in off campus as well as on campus and at the same time.
Sure. So there have been a number of questions and they all kind of get at this same issue of what happens if a student doesn't follow the rules. What happens if they, don't observe, certain kinds of public health guidelines, make bad choices in relationship to them. I don't know, Dean Backegard, if you'd want to share a little bit about how we're thinking about, helping students navigate this period in a way that encourages healthy choices and addresses, unhealthy ones when we need to.
Sure. And I think the first part of that is what's most important for us. We really want to be sure that we're providing students with good information, good education, support, encouragement. Something that I think we may have talked about in some of the other webinars are the healthy ambassadors who are going to be on campus. And these are staff who will be available in the exterior of campus and really helping students encourage students to follow good practices, to provide a mask or hand sanitizer for people who may need it, to applaud students and other community members who are doing a good job following the guidelines, and to help provide some gentle reminders. So that's really where our emphasis is going to be, is around education and support and encouragement. But we have also developed a pretty robust response system as needed. The Office of Student Conduct and Community Standards has created, collaboratively working with students, a distinct process for responding to COVID-19 type cases, things that are related to our public health guidelines and safety for the university community. That process can move a little bit more quickly and make sure that we are specifically responsive to the kinds of behaviors that would manifest themselves here. So I think Isabella has just put the link to those specific procedures in the chat. They also have an online reporting form through the Office of Community Standards. So anyone, whether it's a student, a faculty, a staff member, Providence community members can send information to the Office of Community Standards if there are things that they are concerned about, if there's behavior that they see that they want to be sure to bring to the attention of community standards. The other two things, I think they were chatted earlier, we have an anonymous compliance hotline and another reporting line. So there are different ways for students and community members to be able to access and bring forward information that they have if they are concerned about another student's behavior. The first thing we would encourage, and this will be present in our primary prevention campaign, is for students, for everyone to be able to talk to each other, to be able to raise those concerns. That's the thing that we most want, is for people to understand the guidelines, why they're in place, and then to feel supported in following them. But we want to make sure that we have robust methods for anyone who has concerns to be able to bring those forward and make those reports.
Great, thank you so much. And this might be for both Dean Beckergaard and Dean Rudnick. There have been a number of questions about as students move in phases, will they be able to stay in their rooms, you know, either throughout the term or between terms? And what would that mean for the possibility of having to go through more than one quiet period? Would a student be expected to, let's say, go through a quiet period at the end of August, and then when new students hopefully come to campus as a part of phase 2, be expected to go through a second quiet period? So there's just some questions about housing assignments and continuity and change depending on how the semester unfolds.
I can step in because I've had a number of conversations specifically with our housing assignment staff on that point. And really our goal, if we're going into phase 2, is to make sure that our phase 1 students do not need to go through a second quiet period. So every effort is going to be made that our phase 1 students are housed in such a configuration that when phase 2 students arrive, if the public health situation is sufficiently improved, when the phase 2 students arrive, they can engage in a separate quiet period without impacting students who have arrived in phase 1. That's our primary goal with the housing assignments relative to the phase 1 and the phase 2 arrivals. I know there were also some questions in the chat about whether students can maintain their phase 1 housing assignment into phase 2 if we proceed to phase 2. And I'll also note that we're making every effort to make sure that a student's initial housing assignment is the housing assignment that they can maintain for the entire term. There may be some circumstances in which we might need to move a student from a phase 1 assignment into a different assignment. If, for example, a student were assigned in phase 1 to a room that had very specific qualities that were needed to meet another student's accommodation requests, we might need to make that change. But we're really trying to make every effort to ensure that students who arrive in phase 1 can move into a room that will be able to serve them for the entire fall term, and that if phase 2 students arrive, that does not impact trigger a second quiet period for our phase 1 students.
Great, thank you so much for that clarification. Dean Zia, I'm wondering, there have been a couple of questions about access to academic advising during the quiet period, and I'm wondering, you mentioned the alt PIN number, but I'm wondering if you wanted to talk a little bit about how academic advising will be accessible.
So for all continuing students, you should already know who your academic advisors are for the coming semester. For sophomore students, for the vast majority of you, you're working with the same advisors that helped support you last year. For junior and senior students, you should be working with your concentration advisors. They will all have times to connect with you remotely, online. We also, for those students who have additional questions that need academic advising support, the academic deans in the college have academic advising appointment slots that you can help sign up for. If you email college@brown.edu, we can help connect you with one of them for a meeting. So the goal for this semester, whether you are here and participating in the quiet period or studying remotely, is to make sure that academic advising is available to you remotely.
Great, thank you so much, Dean Zia. So I'm wondering if maybe Dr. Brito, you could talk a little bit about, I know in talking with my colleagues nationally, and there have been some questions about the public health guidelines that students have submitted different aspects of them, whether it's masks, social distancing. And I'm wondering if you could talk a little bit about, from a medical perspective, why observing some of these guidelines that we're asking students to commit to is so important. I know when I talk to colleagues at other institutions, they've really highlighted wearing masks, socially distancing, observing group size, and participating when you're asked in testing. And so I'm wondering if you could talk a little bit about why those things seem to be so important in terms of a community's ability to be healthy and safe.
Thanks. So I think the most important common denominator is the fact that it minimizes the amount of transmission of virus between two people. So the masks act as a barrier to limit, it's not 100%, but to limit the amount of virus that's transmitted in respiratory aerosols and droplets. Same is true for using hand sanitizer. We know that it destroys the capsule that the virus is in. The alcohol does in hand sanitizer, and so does soap. Soap and water can destroy that capsule, and so it completely inactivates the virus. So that's those two things are very, very important. We also know that social distancing is, again, providing literally geographic or physical distance between two people, and the distance through which a virus particle could travel in a respiratory droplet. So by extending that distance beyond 6 feet, we minimize the amount or the probability that respiratory droplets would be transmitted to another person. So those are really important tenets to be done together. Each one of those is important, but together it allows us to maximize the opportunity for moving forward in a healthy way.
Great, thank you. Dean Zia, there have been a couple of questions about access to libraries post-quiet period. Obviously, they would not be accessible during the quiet period. I'm wondering if you could talk a little bit about the libraries.
So what I understand is that the university library is working to help make space available for study space available to students that they would be able to reserve for periods of time. Obviously, there will need to be social distancing within the libraries, and so the number of spaces that are available will be limited. But students will have an opportunity through the library app. I'm not sure, maybe I'm going to pass this. Mike Guglielmo, do you have more information you can provide on that? Because I know that you've partnered closely with the library on this.
Dean Zia, so my understanding is the library access to that would be provided when we go to in-person classes. And that would be currently the October 5th target date.
Great, thank you. And Dr. Brito, to come back to you again, I'm wondering if you could talk a little bit about, there have been a number of questions about what type of test students will be asked to take when they go for COVID testing, because
Right.
there's a lot of discussion about the different types of tests.
Right. There are over 100 different types of testing platforms out there that have had some provisional FDA approval. We will be using PCR testing, which right now is what we feel to be the most sensitive, and it could evolve. This is a very fluid field, and the research is really, really active. But at this point, we're using PCR technology.
Great, thank you very much. So we have just a couple of minutes left. I want to just sort of loop back to the panelists and make sure that in the course of our discussion, there wasn't something very important that came up for you, since you talked about your particular area of important information that you think it's really important for students to make sure that they hear during today's program. And then I also just want to remind everyone who's been able to attend today, if you know someone who's not been able to attend. Again, we're recording this so that it can be posted probably within the next 24 hours to the Healthy Brown site. So if a student or a parent wasn't able to join us, they would still be able to hear all the really important information. But I did want to give the panelists just a chance in the last 2 minutes or so that we have. If there's something that you've thought of that you think is really important for students to be thinking about, to know, around move-in and quiet period that came up for you as we were talking, please do feel free to share.
One thing I'd like to jump in with is to point out the importance of the RPLs, the residential peer leaders. If you have questions, concerns, if you're struggling in any way, use them as a resource. Let them help connect you to campus resources. Keep in communication with them if you're living in the residences or working with an RPL in a remote capacity, because they can be a very important part of your own success. And they also are going to be doing a lot of fun things throughout the course of the semester that will help to keep you engaged while you're going through the academic year.
I just want to note that I think there have been a number of questions that have come in that in one way or another pertain to how are students being monitored or observed? How are we going to ensure compliance during the quiet period and beyond? I want to assure students that we're not tracking their movements, but we do call upon students to understand how serious this moment is and how we are all placing our health and well-being in one another's hands, so that we do expect students to learn and follow and abide by all of the guidelines being set forth. And we're really going to call upon students to be able to have conversations with their peers when they observe behavior that concerns them, to be able to support each other in good practices, and to make sure, even though we have all of those robust measures in place to respond through the student conduct process, I'd rather not use them. I'd really rather call upon students to understand how important this moment is to take care of each other as a community.
Thank you very much. I'm going to use this last minute to exercise the moderator's prerogative to have the last word. And I just want to really emphasize what Dean Bakkegaard shared. We really see ourselves as all in this together, that we are a community of students and faculty and staff and community members that are hoping that this phased reopening will be successful. And that's going to require a commitment on the part of all of us to observe and follow the public health guidelines that you've heard more about today, that you continue to hear more about, that you can read more about on the Healthy Brown website. If phase one goes well, and there'll be approximately 500 students coming back in phase one on campus, if it goes well, we will be able to move to phase two. If it doesn't go well because people make choices that result in not following the public health guidelines, moving to phase two will be much more challenging and may not happen. So I think we are all sort of hopeful that we can support each other, affirm each other in being able to open in a way that is healthy and safe, and follow a plan where health and safety really has been at the heart of the decisions that have been made. We know it won't be easy, but we also know that we're in it together as a community and want to work together. So thank you very much for joining us today. Again, the webinar is going to be online on the Healthy Brown website. I want to thank my fellow colleagues who presented and who answered questions. We know that you submitted more questions than we could have possibly answered today. We tried to do our best. Please feel free to continue to submit questions to us through the appropriate office emails and phone numbers, because we're here to support you as we move forward. So thank you very much. We look forward to seeing you very, very soon. If you have not already, come back to Providence, and look forward to seeing you then. Take care, travel safe, and be well.